Welcome to another episode of A Doctor's Journey podcast, navigating life and medicine with coaching and healthcare innovation. And I'm your host, Miguel Villagra. I'm a board certified internal medicine physician, hospital medicine, telemedicine provider, and digital health advisor. I'm also a positive intelligence and life coach, and I have a platform called A Doctor's Journey where we share stories of physicians that are disrupting the status quo of our healthcare system and driving innovation. And today I have the privilege of having an amazing guest, Dr. Barry Chaiken. He is a distinguished figure in healthcare innovation with over 25 years of experience in healthcare information technology, clinical transformation, and business intelligence. He has advised organizations such as the National Institute of Health and the UK National Health Service, focused on patient safety, clinician technology, adoption, and change management. He also have accomplished an amazing milestone writing a great book that I have the privilege to go in or get into it, named Future Healthcare 2050, How Artificial Intelligence Transform the Patient-Physician Journey and Navigating the Code. How technology transformed the patient-physician journey. And I'm going to tell you, Barry, you got me already with the title and the tagline of the book. Because my brand is A Doctor's Journey. I share stories of physicians and healthcare innovators. But the reality is that the journey of the physician certainly has to be aligned with the journey of the patients and the ecosystem where they interact, which is our healthcare system. But I need to underscore the privilege of having you here today on my podcast, and I would just want to welcome you. I always try to start by asking my guests to share a little bit of their journey. I'm fascinated by your bio, and I'm interested in seeing how you get into healthcare technology and innovation. Welcome, Barry.
Thank you so much for having me. It's really an honor to be able to have an hour conversation with you.
Thank you. So tell me a little bit about your background story again, where you're coming from, how you get into healthcare technology and innovation.
Really interesting stories. So I think I want to start as I actually start in my book. I was at the Harvard School of Public Health, and I took this course by Dr. Heather Palmer, who taught a course which was really amazing at the time. This is the 1980s. The course was on quality of care. Now, everybody today thinks about quality of care. We pay attention to it, we look at metrics, etc. But back in the 1980s, people didn't look at quality of care. They were starting to develop various types of tools that would do DRGs, for example, were developed in the 1980s. So people were mostly focused on the financial part of healthcare, but not so much on the quality part. And Dr. Palmer actually taught a course in that, and that got me very interested in the subject. I carried that through to when I joined the CDC as an EIS officer. For those of you who don't know what that is, that's an Epidemic Intelligence Service officer. They used to call them medical detectives, and that's essentially what they do. Anytime there's an outbreak, the recent outbreak of measles in Texas, the CDC would be called upon, so their young epidemiologists would go out and work up the epidemic or the problem. Also, the CDC also expanded into the areas of occupational health, but I was mostly participating in infectious diseases. So when I was at CDC, they rolled out into the auditorium a computer, a PC that actually did various types of statistical analysis. And then when I joined CDC, I bought my first PC, which was an IBM PC with floppy disks and limited memory and all of that. And that started my journey on using technology. And I have to say that as much as I'm a technology adopter, I always look to use the technology to accomplish something. It isn't that I take the technology and get excited about what all the nuances of it and the interesting things about it. It's like, can I use the technology to do something new? I have to tell you, a lot of the technology I've purchased in my lifetime has been very helpful. But when you are on that, I'm not on the bleeding edge. I like to think I'm on the leading edge. Some of the technology doesn't really fit, but it's also about focused on how you can use technology with human beings to accomplish particular tasks and achieve particular goals.
That is fantastic. Now, in your book, you describe AI as a tool to enhance clinical decision making rather than replace the human expertise. Could you elaborate a little bit how AI you think will complement the thought process of a seasoned clinician?
Absolutely. But you know where I want to start? I want to start on the problem of AI, the potential dangers of AI, and then get into how we use it because the two things are very much related. We know that artificial intelligence does not know anything. It has no opinions. It has no goals or objectives. All it is statistical relationships between various words and numbers and things like that. So it was built on how people think the brain works. And we still don't know exactly how our brain works, but we think that it's built on that and something called a neural net. So what AI produces is solely determined by what information and data it's trained on and the algorithm or the model that was used to absorb that information. The other thing you always have to remember about AI, it's like your dog. It loves to please you. So AI is always going to try to give you an answer that's going to make you happy about that answer. It's not necessarily going to argue with you as maybe somebody else or a human being might actually do. One of the problems of AI is that if it doesn't have the proper guardrails, it hasn't been trained in the proper data, and it doesn't have the proper model, it could potentially produce things that we call misinformation, hallucination, just basically wrong result. Now, we have that as the model. Now, how would we want to prevent those bad information, those bad suggestions, that bad clinical decision support? How would we prevent that from causing a problem? Let's go ahead and insert a human being in that particular process. So now we have the AI. Let's consider that as a knowledge base, a clinical decision support. We have a human being. The AI is a brand new source of clinical decision support. Now we have to figure out how do we go ahead and develop the best clinical decision support of AI and integrate it with a clinician in the proper workflow so that the physician, the nurse, the therapist, the clinician is always a backstop to prevent the AI from producing something that might be misinformation. In order to use AI properly, let's develop the best models we can, train it in the best data, identify the limitations of the data we have in training that model, and then incorporate it into a clinical workflow that the physician sees that as an adjunct, an addition, help in the work that they're doing. The nurse sees it as help in work that they're doing, but doesn't replace the clinician in making the decisions. Now, we know that access to things like UpToDate and other databases are very helpful to the physicians and nurses to make good decisions in taking care of patients. We have to think of AI the same way. Not that it's going to direct what happens, but it's going to help direct what happens to a particular patient to help them with their disease process or health problem.
Yeah, thank you for underscoring the limitations of AI because I always like to, and I have tried myself different tools and interview some other developers, and I always like to break it down into the healthcare and non-healthcare applications because it's not the same writing a system for an email that having an oversight of a patient care at the bedside, right? When you have a tool advising you to prescribe a specific antibiotic or a specific test. But I do love how you frame it, right? In a way that this is more like an enhancement and even a co-pilot, even a navigator tool where you need definitely the component of a human oversight. And I want to ask you, and I want you to reflect with this question, because one of the things that I see as these tools are developing is how we can trust in them, right? So going back to their limitations, where they're coming from, when you are implementing anything, particularly that was changing the way we practice medicine to some degree, right? Using these new technologies, how you will frame it to providers, how they can build trust and how they can kind of apply those into their workflow and their thought process as clinicians.
That's a really good question. As more and more physicians are working for corporations, profit and not for profit, they're going to be given various AI tools that they're going to be asked to utilize. And the question is, how do I, as an individual clinician, focused on the welfare of my patients, focused on delivering the best outcome for my patients, how do I know that the organization that shares with me this AI tool is something that I can trust and I can actually use? The real challenge for those organizations who are not, except for maybe a large academic medical center, are not going to develop these AI tools. They're going to purchase them from technology vendors. So the question is, how does the organization know that the AI tool that they purchased from a technology vendor is something that they could trust, and then share that with the clinical staff so they also can trust it? That's a huge issue. We know in the purchase of technology historically, we've seen demos and we've decided that based upon recommendations, we bought different types of products, particularly electronic health records and such. Purchasing an AI tool is going to be much more difficult because you need to understand how it was trained and what the algorithm was like. And most organizations do not have the expertise to actually deep dive and understand those issues. Those data scientists and AI experts are very few and far between to find them, and most organizations won't be able to get them. So first off, the organization has to go in and make sure, what did you use to train your model? Does it represent the patient population that I'm supposed to be taking care of? And how did you go ahead and test the model to make sure it works? The outputs are good. And also, what are you going to do to make sure that the model stays up to date? How are you going to train it and how are you going to test it? Once the organization purchases the model, they have to share that information with the clinical staff. And I highly emphasize this, they need to pilot test it and make sure that when they pilot test it, it will go ahead and suggest something or move in a particular direction. The clinician has to be right there in the middle and evaluate whatever those outputs are to understand whether the model is producing the outputs they want. It's a whole process. And because unlike other clinical tools where you can actually examine what's inside the tool, what the algorithms were based on, what the branching might work, those types of things, AI is a black box. We'll never know how those neural networks and models and statistics and probabilities interact with each other to deliver their output. So we can't examine anything other than understanding what data were shared with the actual model and very high level parameters of the model. And then the only way we can know it works is to keep testing it and evaluating it and making sure that it delivers the outcomes that we want.
I totally agree with you. I think that I always has mentioned that there has to be at the organizational level this, I would call an ethical oversight, right, of the process, how this will be implemented, how this AI system will remain fair, valid, safe, and preserving the human judgment. And I think that's kind of what I'm getting from our conversation so far, that need of the human oversight. And ultimately, the users of these products are the providers and clinicians. And it's important for them as they pilot these products to be able and have the channels to provide the proper feedback to make them better, or even to change them if necessary, or remove them from others. So that kind of goes back to the alignment between the healthcare organizations and the clinician and providers, and it requires both to work together to make this as safe as possible for the ultimate user, or even the one receiving end, which are the patients, right? And as this is happening, I want to ask you about a topic related to the algorithm bias, right? I think there's a significant challenge with AI adoption, and what strategies would you recommend for addressing bias and promoting transparency in healthcare AI system?
Bias is actually a really big problem. The organization needs to understand what data was used to train the model. If any of you want to learn what that means, go ahead and take one of the AI tools that you can access online for yourself. Give it some information and ask it to write an article on that information. When you read that article, you will understand that the AI doesn't know anything about you. So what it's going to write is not going to resonate with you at all. So how do you get the AI to resonate with you? You have to share many articles, answer many questions by asking the AI what it wants to learn about you, before it even gets close to be able to write something that really is truthful and representative of you. Now, let's take that in a bigger picture. We want to make sure that the AI is relevant to my patient population. Let's assume simplistically, I'm a pediatrician. If the AI was trained on adult medicine and they'd had very little pediatric medicine training, obviously what it's going to give you as a result is not going to be representative of your population, of the children that you're treating. That's a very extreme example. So you have to make sure it's representative of your population, ethnic group, age, sex, race, even geographic area is important because people have different preferences in different parts of this country, let alone different parts of the world. So that has to be included also. And then what you have to do is you have to go in and you have to test it and see what it actually produces for you. If there are biases in it, and there surely will be biases in it, you have to understand what those biases are and try to correct for them. One thing if you're able to do is if you're able to take data from your organization and train the model on some of your own data, or if it isn't available, identify a source of data from some other place that's representative of your population and make sure the model is trained upon that. That can be very useful too, because if you have a small organization, you may not have enough data to truly train the model for a diverse population that you're treating.
Got it. So now your book highlights the role of AI in streamlining operations, reducing administrative burdens. And I want to ask you if you have any examples of how this capacity of improving this workflow works in real.
But I think the one area that would be most helpful to streamline, right? And they're starting to do this, is the whole area of pre-authorization. Pre-authorization is a hassle for the doctor. It's a hassle for the patient. It's a hassle for the provider organization, and it's a hassle for the payer. Think about how complicated healthcare is. Say you have employee-based healthcare, you have 3, 4, 5 different plans that you can sign up for. They all have different deductibles. They all have different copays. They all have different provider networks, in-network, out-of-network, very complicated things that need to be pre-authorized and those things that do not. If we can use the AI to understand that process and be able to automatically authorize something if it makes sense. If the data is already in the electronic health record, it can pull it out. It says, okay, it meets this criteria, we approve it. It can do things like, hey, this physician has ordered an MRI on the last 100 patients and we have never denied that MRI. So let's go ahead and just approve it and not bother the patient, the physician, and the staff to go fill out a bunch of forms that actually need to be done. All of that is an issue. It can also streamline the work that the patient has to do. It can tell the patient, I need this information or that. Here's an easy way to provide it, and it's done. AI is really great because it can understand experience and it can apply statistics to be able to figure out what should or shouldn't be examined within a pre-authorization process. I don't think there's anyone out there who wouldn't be happy to make the pre-authorization process a little bit more streamlined and easier to follow through on. It's one of the things that clinicians feel the most angst about.
Fantastic. I want to ask you about a couple of other ideas or applications that you might have. And I want to point out two that I have seen, and I think there might be some value in it. The first one is having these potential ways of communicate to our patients, like either automations where patients can be reminded of using their medications or using predictive analytics to see if the compensation might be coming of their chronic disease. And I think that could be a potential, and I want to hear your thoughts on that specific and the risk also of that specific application or tool. And the other one that I have seen evolving so rapidly is the use of AI medical scribe, these tools that will record the patient conversations. And there's a lot to unpack in something like this, right? Including the level of trust physician-patient, where you're recording this conversation and how it can potentially improve the hazard of the documentation process, where a lot of physicians complain about having to sit hours either dictating or typing notes and things like that. So there are two different questions, but similar, two different applications, which I want to hear your thoughts on both.
Okay, let's talk the first one of the patient interaction. Today, when there's interaction between patients to comply with medications, comply with pre-operative work or post-operative work, it's pretty much generic in the sense it doesn't know anything about me. It talks to me in a way that is just an average. There's no personalization of it. AI can personalize those interactions with an individual patient. It can understand what the patient's ethnic background is, the language, where they are, and all these different information about them. And then it can go ahead and communicate with them in a way that is probably going to be more impactful in then following the instructions that they're given. And in terms of taking medications in chronic disease, you can imagine you get a notice that says, oh, it's time for you to take your medication. That's fine. But if it's something that says, hey, I know it's Monday, you're taking your daughter to work, you're taking your daughter to work today because it's that kind of day, it's really important to take your meds. It's a simple example, but it makes it personalized. The person receiving it believes that the AI or the message cares more about them. It's more likely to incent the people to follow through with it. It also can do things like, hey, you didn't take your meds last week, or you didn't fill your prescription. Is there something that we need to know on why you didn't fill it? And if you think of, we could do that today, but it requires a tremendous amount of effort by human beings to accomplish it. Those types of personal interactions can be very helpful, I think, to patients. And evidence of that is you see people using AI as to think of ideas, to address particular issues, even to plan a vacation. It's almost a companion. And I think in a medical environment, it can also function as a companion also. What was your second question again?
It was about the use of AI medical scribes and how they can potentially help in the documentation process, uses, risk, and how it can shape the patient-physician relationship if you start using it with the masses.
One of the problems with electronic health record is there's so much junk in it, and there's so much information in it that is correct and is also incorrect. Copy and pasting has created a lot of misinformation that actually exists within the medical record that gets repeated over and can actually produce a bad outcome. So what the medical scribes can do, it can learn from the physician, maybe previous notes on what's important to that clinician. And then when it goes and listens to the interaction between the doctor and the patient, it can record things that the AI learns is important to that patient and to that physician for their care. It's obvious that if the physician isn't typing and looking at a screen, but actually looking at the patient, their interaction is better. They're more likely to get better. The clinician is more likely to get better information from that actual patient because they're humanly engaging with them. That can help tremendously where doctors don't have to spend time after they get home, have dinner with their families, and then move on for another 2 hours in front of a computer till 10, 11 o'clock at night or midnight, having to do notes. And the quality of notes should not be a function of how fast the clinician types. And using AI, we can enhance the electronic health record, the information that's entered into the electronic health record. We can also, because the way it can be done, the AI can summarize that information for the next visit and identify through learning which items are most important for the clinician to actually know in seeing the patient next time. And oh, by the way, it can collect a little information about the patient that can do simple things like, oh, it's good to see you again, Mary. How's your daughter, Andrea, doing at school? And those are the types of things that clinicians have tried to include in their records, but now they're so busy, it's really hard to. The AI can help all of that piece to make the interaction between the patient and the physician much richer.
Awesome. And to extend on the latter is about the documentation time. And you're absolutely right about there is a lot of misinformation that is being carried on from the copy and paste phenomenon in electronic medical records. However, this could be a good way to have us a fresh start or moving forward, so to speak, with more accuracy. So now, on the flip side, do you think that these can change in some way, or how do you foresee that change might be in the future about the physician-patient relationship as we adopt more of these tools?
I can't imagine that the clinician looking at a patient instead of looking at a screen, interacting with them, asking them questions, having some background about the previous visits and what's important, that has to enhance that particular relationship. In addition, when the patient leaves with AI, there can be still interactions between the patient and their clinical staff, even if the AI is managing it. So we get closer to a more personal medical care that maybe we had 20 or 30 or 40 years ago. It's more personal medical care, and the patient can feel that they're better connected, not only to the clinicians taking care of them, but also to the health system as a whole. And I think that can only lead to improved outcomes. And if people are worried about the cost of these systems and such, if we implement them properly, we can improve that patient, physician, clinician, patient interaction. And it's not as if we're adding a lot of people and high expenses to be able to do that by having to have people do it. We can do it through the technology if, and only if, we choose the right technology and implement it properly.
Great. I coach physicians, and I know burnout is one of the main hurdles that is part of the journey of any clinician, pretty much, particularly in United States. And again, I was alluding about the documentation time as one of the main, most common things that I hear from providers, that is a time sucker, so to speak. That's how they describe it. On the flip side, the reality is the physicians were not that good for change. We have a different way we are very slow to adopt. Even medical research, don't let me start talking about new technology. And I want you to see if you can give me some thoughts or reflects upon that idea of how do you see the friction of implementing this technology from the perspective of the clinician that just don't feel ready to start using it, or even might feel threatened by them.
First off, it's always very important to understand what people's agendas or what's important to them. But I've been asked this question for many years about the introduction of new technology. And I have to tell you, I have never met a radiologist who said, I don't want you to install the next version, best version of the new MRI machine. I have never met a surgeon who said, oh, I don't want to use the best new endoscopic equipment or imaging equipment or sutures or what have you. So the issue isn't so much that clinicians are resistant to change. Human beings are generally resistant to change. Clinicians have a different spin on this. The thing is that if you go and look at the literature, you will find that in order to predict how a clinician is going to practice, all you have to do is see where they went to medical school and then where they did their training. And if they were trained on the West Coast, they're going to practice the way they do in San Francisco, for example. If they were trained in Boston, where I live, they'll practice the way they were trained in Boston. Why do we do that? The reason we do that is because clinicians do not want to harm patients. And if they learn that a particular therapy, process, approach works, they stay with that approach because they don't want to cause any harm. Now, what we do know is that medical care advances, and holding on to an older method of doing something, even though it was effective then, there are newer methods that are better, less morbidity, mortality, and even cheaper. So how do you get the clinician who is reluctant to change because they're a human and because they don't want to hurt patients to adopt new technologies? The way you do that is you educate them about this new technology. You show them what the advantages are and the risks are associated with it. Remember, they think as scientists. You provide them with that data. You involve them in the evaluation, implementation of that particularly new technology, and they're more likely to accept it. That's a lot, clearly. How do you convince them? You can't have every clinician evaluate every single tool. You have to, like in everything else, identify influencers who are convinced that the technology will work, and they work with their peers and show them that it's valuable. Also, make sure you keep the clinician as part of that clinical workflow as that stopgap or the backstop to the AI. That way they will feel in control. And the last thing I want to say is, if you can, focus on outcomes, link the outcomes to the intervention and the processes in between, and that will be very impactful to get the clinician to follow through in accepting the new technology.
I love it. That was great, Barry. I love it. So now let me ask you though, do you see or in practicality any other barriers, either at the clinician levels, but more important at the healthcare system levels of adopting this technology, any other roadblock or friction points that you have identified?
Well, first off, healthcare is in a bit of a crisis in the US. The cost of care is going up, and we have a physician shortage, we have a nursing shortage. All of those crises are taking attention away from these using new technologies. And because we're going to have to put a significant effort into evaluating them, I think the uptake in using them is going to be a bit slower than we might think, particularly in the area of clinical care. So my recommendation is choose non-clinical care areas where you can go ahead and improve the patient experience, the clinician and non-clinician experience, like staff and stuff, and reduce costs. If you can do those things, you will start to get a proof of concept and acceptance of the AI, and then you will give some time for the AI on the clinical side to develop, evaluate by leading edge organizations can evaluate it, and then you can figure out what you want to do with it. There's so much we can do with AI in the non-clinical side in a hospital to improve patient experience in those other areas I mentioned. So it's important for us to actually go there first. It's going to sound like a cliche, but you got to take baby steps with this stuff because one, it's brand new. Two, it changes all the time. In a month, the AI is better than the month before by leaps and bounds. So we have to be slow in its adoption and understand that it's tied to the outcomes that I mentioned before. Cost is going to be an issue for organizations because these tools are not going to be inexpensive as sold by the tech companies. I do have a warning though, for anybody who's thinking of purchasing any of these AI tools. There was President Reagan once said when he was talking about the old Soviet Union, trust but verify. And this applies so strongly in this particular area of AI. Before we can buy an EHR tool and maybe it didn't do what we wanted and we tweaked it and we can fix it and make it work. In the AI, it's much more difficult because remember, it's a black box. So if they say it can do a particular thing, say, okay, now show me, prove it to me, and show me the data on what you use to train it, the model you use, so I can at least on a high level evaluate whether it's going to deliver to me the things that I want. I think that will be a bit of a barrier to the level of adoption, that and obviously the cost of these various types of tools.
Yeah, no, definitely. I understand any new technology will have an upfront cost, but the trade-off has to be the benefits that comes with it. And I know you discussed the economics of healthcare AI in your book. So where do you see the cost reduction and resource allocation in healthcare system with adopting these technologies?
Thanks for that. I want to make sure everyone understands AI will eliminate some jobs, but the challenge is for an organization is not to eliminate the people, just eliminate the job titles and work to train and reposition those people that you have in your organization to do other types of things that can be, one, better for your organization, better for the patients, and frankly, even more rewarding for those individuals. So I think the economics of AI is going to function around reducing the friction associated with our claims processing system, the pre-authorizations and all of that's associated with it. Also scheduling, I think, is a big area that we can actually improve. And then things like patient education and patient follow-up, I think can be impactful. We may believe that we can produce better outcomes at lower costs. People have been saying that for a long time, so I don't want to jump on that bandwagon and say that we're going to do it. I think we can if the AI is implemented properly, but if we need to focus on the outcome to make sure it's doing what we think it's going to be doing. So again, the big areas of economics are getting rid of friction in an organization so that way you have fewer people or the same number of people doing many more things that are beneficial to your organization, decreasing physician time associated with administration work, same thing with nurses and other clinical staff, and then administrative staff will do things that are more useful for patient care and for the organization and not doing a lot of the mundane things that we know technology, virtual assistants, and others can actually do. Will it decrease the cost of care? Mm-hmm. Who knows? We've thought a lot of things were going to reduce the cost of care So let's not focus on reducing the cost of care. Let's focus on taking the resources that we have and get better value for them. That's
I
the
love,
focus. We
I
spend the
love it.
money, let's get better outcomes, longer, shorter lengths of stay, longer lifespans, healthier lifespans, things like that, as opposed to focusing on the money can take care of itself if we can actually get more value from what we spend.
I love it. I love it. So let me ask you, Barry, do you have any advice for healthcare leaders as they prepare for this, I would say, workforce transformation that is coming ahead of us? All these new roles that will integrate AI into healthcare. Any advice, tips on how they can be navigating these changes and be prepared for it?
I think a healthcare leader, one of the most important things they need to do is to understand what AI is. And I mentioned that earlier in this discussion. It's statistics, it's probability. It's an algorithm that uses statistics and probability to evaluate a training data set that then from all of that produces a particular outcome. You have to understand it has absolutely no knowledge. It has no opinions. Its opinions are generated by the training data. That is, their opinions are its bias. So understand that. And it doesn't have an agenda. It doesn't want to do one thing or the other. It just wants to please you. And how does it please you? It wants to give you, based upon probability and statistics, an answer that you like. Let me give you a really good example of this whole idea. If you've ever used Midjourney, and Midjourney is a image generation software, it's online, and it uses AI. Now, in Midjourney, they have something called a seed. What is the seed? The seed is a random number. So you put into Midjourney, give me a photorealistic image of a man standing on a New York City street at night in the 1950s with black and white, okay? It'll produce that image. Now, if you ask it the same thing again, it will produce a completely different image. The reason why is because in the creation of that image, it uses another seed or random number. But if you put in the same random number as the first time, you're able to do that in Midjourney, the image would be almost exactly the same as the first one. But with a new random number, it's different. Why do I tell you that story? Because if you go into AI and you ask it for a response, it will give you a response. If you ask it again, it will give you a different response. Why? Because it's all based on probabilities and statistics. And when you ask it a second time, the probabilities vary because it's not a 100% linear path. Oh, it'll go from 90% here, 48 and 85% there, and it'll bounce around to give you a response. That's why if you understand that, you can better evaluate these tools and understand how they might fit in your organization. Again, it's not like you and I. It's just a computer that has a bunch of probabilities and statistics in it.
I love it. This has been an amazing conversation, and I want to spend the last few minutes to kind of take a sideway into entrepreneurship, Barry. A lot of physicians that are part of my network, my audience, some of them even my coaching clients, have entertained entrepreneurship, tried to build their own businesses, become business owners, either in healthcare or even out of healthcare, coaching, etc. I want to ask you, you are a thought leader, an entrepreneur, you have write books, and I want to see if you can have any practical advice for any physicians at any stage of their career that are considering getting into entrepreneurship.
Oh my goodness, we can speak for hours about that. I believe that the marketplace generally has a bias against clinicians. The reason why they do is we're highly educated, we're obviously intelligent. And the last one is when people speak to clinicians, to physicians in particular, unless they've been working with them for a really long time, they revert back to some biases that they might have, which is common phrases, doctors don't know anything about business and they're not good business people. The other bias that they have is they remember, even a little bit, they remember the last time they saw their own doctor. And they see that in you. And so therefore, their perception of you is a little bit off. And they have this how can I describe it? A little bit of cognitive dissonance in their head, which is one is they're looking at you as a business person they might be working with. On the other hand, they see you as their own personal physician that, or their child's physician or their wife or husband's physician that did something wonderful for them, or their family, or did something that didn't work out as well as they want. So there's this skewed view. So when you interact with any of these people outside the profession, you have to assess what is their real perception of you. Do they see you as a business person of an equal, or do they see you as a doctor who might have some assets that they want to start a business in? So I think that's really important to understand. The other thing that you need to understand is that unlike in most clinical care, where the patients come to you, in business, the clients don't come to you. They don't show up at your door. So instead of this inward focus that you get when you're taking care of patients, you have to flip that around and have an outward focus and say, I have to go after my patients. I have to go after my customers. I have to go after my investors. I have to go after the people, my vendors who are going to help me build my business. That's a complete different shift about it. And the last thing is you have to understand that there's some things you're just not going to be able to do. Your skill set, if you're a surgeon, you're really good at seeing things in 3 dimensions, right? But if you're a non-surgeon, there's probably a reason why you didn't do surgery, because maybe you didn't like it, or maybe you don't see things in 3 dimensions, but you're able to understand other aspects of medicine that you feel more comfortable with and have a skill set in. So realize that you don't have all of the skill sets, and you need to bring in people who can advise you and help you accomplish different things. And lastly, and this applies to every entrepreneur, particularly if you're starting a business, if you're successful, you're going to come to a point where the business is going to outgrow you, where you're going to need somebody who has a different experience and skill set that you have, and you're going to have to figure out where are you going to be in that organization, right? And let go of the reins to let somebody else to manage that business. That's really hard for any entrepreneur, but it's particularly hard for us physicians who clearly we need to feel we have control over taking care of our patients because they're so important to us. And when you have a business, they're not as important as taking care of a patient, and you may have to let go a little bit.
So many pearls of wisdom, Barry. That was just amazing. And let me ask you, any final thoughts that you want to share with the audience? And also, I want to make sure that you share how people can connect with you, reach out to you, and what resources you have available for them.
Sure, I appreciate that question. Last final thoughts. I spoke about some of the problems of AI. That doesn't mean it can't do really wonderful things in healthcare and outside of healthcare. It's really up to all of us to figure out, can we set the proper guidelines? Can we do the proper training in those models? Can we implement the technology in a proper place that it produces the outcomes that we want? Focus on the outcomes, link it to the technology, and I think you'll do very well. Let's be optimistic, but be cautious at the same time. And I think we can have really great value from using these AI tools. If you'd like to get in touch with me, almost all of my content, frankly, is on barrychaiken.com. There you'll find all of my blog articles, information about some of the services that I provide. You can actually buy one or both of my books, and you go to barrychaiken.com and just look at the books. You can read about them. If you do buy any of the books online from me, I actually give you the deluxe copy. I sign them, and if you want, I can put in a personal inscription, anybody that you want. It's also available on Barnes & Noble and Amazon, also as ebooks, so you can get them there too, but you don't get my signature and you don't get the nice paper. So either there, but the content is going to be exactly the same in either of those different settings. And if any of you are on LinkedIn, I'm on LinkedIn, please reach out to me. I love to connect with people all the time. I do a weekly LinkedIn newsletter called Future Primed Healthcare, where I cover some of the topics in my book. And then at the same time, if there's anything that's really topical in the AI space or healthcare space, I actually will go and write about that too. I also produce a little video using avatars, which is a summary of all of my newsletters. So please visit barrychaiken.com and see if you find something that you're interested in. You can also reach out to me through that website.
Thank you for sharing all those resources. We're going to add all those links to the episode transcript so people can have access to it. And I just want to once again tell you how grateful I am to have this opportunity to kind of learn from you and so much wisdom that you share with the audience. And I just want to say how grateful I am that you've been here with me. And so we're going to wrap things up. And once again, a Doctor's Journey podcast, Navigating Life and Medicine with coaching and healthcare innovation. And we will see you until next time. Thank you so much. Thank you, Barry.
Thank you.
Thank you for joining for another episode of A Doctor's Journey podcast, Navigating Life and Medicine with Coaching and Healthcare Innovation. I'm your host, Miguel Villagra. I'm a physician, life coach, positive intelligence coach. I'm a healthcare advisor, and I hope you found this episode useful in your journey. Remember to connect with our community at adoctorsjourney.com. There are multiple resources that can be highly useful on your journey and support. Stay in touch with our community. Until next time.